Thank you, Mr. Speaker. Senate Bill 74 is a piece of legislation which simply defines the membership and the duties that will be created by DPH in the Child Fatality Review Team and Maternal Fatality Review Team as two separate review teams. It will facilitate the development of local child fatality response teams. It will collect data and coordinate as requested by the Child Fatality and Near Fatality Review Panel. It will provide oversight and analysis of any programs that are intended to prevent or reduce risks to mothers and infants and improve health outcomes in the first year after childbirth. It requires an annual report, which will include recommendations to the interim joint committee on health services. And the last piece is that the Cabinet for Health and Family Services will collect data on different types of childbirth, delivery, and procedures during delivery and include an annual report to LRC. Mr. Speaker, I would like to ask the clerk to please report House Committee Sub 1.
Clerk, please report.
House Committee Substitute 1 to Senate Bill 74.
Lady from Kenton.
Thank you, Mr. Speaker. This is simply a cabinet cleanup provision. It changes required statewide system for stroke response and treatment and the annual reporting date to September 1 of each year. It amends and changes the definition of home visitation and home visitation program and makes technical changes. It allows for an electronic agreement to be submitted for the HANDS program, and it changes the reference from local registrar to a state registrar and moves up the timeline for the submission of birth certificates from 10 to 5 days. It makes changes related to individuals that compile interdisciplinary reports, simply adds one employee of the Cabinet for Health and Family Services with relevant expertise and makes technical changes. If there are no questions, I move adoption.
Motion is for the adoption of House Committee Substitute 1. Is there any discussion of the committee substitute? Seeing none, those in favor signify by voting aye. Those opposed, nay. House Committee Substitute 1 is adopted. Lady from Kenton.
Thank you, Mr. Speaker. I'd like to ask the clerk to report House Floor Amendment 2.
Clerk, please report.
House Floor Amendment 2 to Senate Bill 74.
Lady from Kenton.
Thank you, Mr. Speaker. This House floor amendment will add the provisions of the maternal health momnibus legislation, House Bill 10, with the original House Committee sub, and the floor amendment which exempted short-term limited duration plans and small group plans from the insurance coverage requirements for the special enrollment period for pregnancy to Senate Bill 74. This all passed the House unanimously. The Senate Committee sub, which was added in the Senate, has been removed in this floor amendment, and the only additions to this are a provision that will align federally required coverage with the state if a cost defrayal is triggered in Section 13, and it requires the Department of Insurance to apply for a waiver if a cost defrayal is triggered. Mr. Speaker, if there are no questions, I move adoption of House Floor Amendment 2.
Motion is for